COVID-19 has altered medical care, not just for vulnerable populations like the immunocompromised and the elderly, but also for delivering moms and their newborn babies. We're going to give you some tips to help you during this trying time. Bringing home an infant can be a joyful time, but it can also be a stressful time. And the current COVID-19 pandemic has, for some parents, increased this stress for both moms and their newborns. Some of the common concerns that we hear from patients are, will I be able to have my postpartum visit in person? The American College of OBGYN does recommend that you see your doctor within 3 weeks of delivering your baby. And depending on your situation, you and your doctor might decide that this first visit can be done via telemedicine so that you don't have to come into the clinic at that time. Your next recommended visit is within the next following weeks, and the timing of this visit and whether this is done in the office or also via telemedicine can be a decision that's made with you and your doctor, and your preference will be emphasized in this decision. While you are at increased risk when you leave your home, rest assured that if your doctor and you decide that it's important for you to be seen in the office or for you to bring your baby into the office for a newborn visit, we are taking many extra precautions to decrease the likelihood that you might be exposed to COVID-19. Seeing newborn babies and children for well visits in the morning, screening all patients the day prior to their appointment and upon arrival for any COVID-19 symptoms or sick contacts or contacts of patients who've been recently tested. Social distancing in the waiting area. All of our staff and employees wear masks. The answer for that is yes. You will have direct contact with your doctor. You can discuss all of your symptoms, and many issues can be resolved via telemedicine. If it is deemed that an in-office visit would be beneficial, this can be scheduled in a timely fashion, often within the next day. Many questions about breastfeeding or other concerns can also be addressed via telemedicine. We have a lactation consultant that's available at our Legacy Southwest Clinic Monday through Friday, and we can refer you to that person if needed. Just some other advice about reducing stress during this time. It's important for new moms to try to get as much sleep as possible. One good strategy is to sleep when your baby sleeps. Take offers of support from people in your home that are willing to help you with the baby. Don't try to do everything yourself. Try to get outside every day, especially if it's sunny. Get in the sun, go for a walk with your baby. Social distancing, of course, but exercise is very good, as well as getting plenty of water and a healthy diet. And if you feel like your stress or other symptoms like depression or anxiety are becoming more problematic, don't hesitate to contact your doctor, because we have much support here at Legacy to provide for these issues, and we can refer you in a timely fashion.
Infants are actually at higher risk of severe illness from COVID-19. This is likely due to their immature immune system, and also they have smaller airways. This makes them more likely to develop issues with breathing as when they get a respiratory viral infection. The risk can even be higher for premature infants.
Currently, the concern is not, can a mother pass the virus to her infant in her breast milk, but more so if she could pass that to the baby in the way that you would pass the virus otherwise, through respiratory droplets. So it's important that if you are found to be COVID-19 positive, or if you have symptoms, that you take the necessary precautions to limit respiratory droplet exposure to your baby. This would include diligent hand washing, and wearing a face mask when at all possible. So just like when we are not in a pandemic, it's important to only expose your baby to a limited number of people who are feeling well, and to be diligent about asking the people that you have around your baby if they have symptoms, or if they've been around anyone who has symptoms or been tested for COVID-19.
Moms who are not infected with coronavirus, if they get exposed later on after giving birth, then they can pass it on to their babies. Things that you need to do is to protect yourself as well. First, hand washing is very important before touching your baby, and anybody at home who's gonna be caring for the baby. Wash your hands, and the using proper hand washing techniques. Okay, it has to be 20 seconds of scrubbing your hands. If you are pumping breast milk, wash your hands before pumping and clean all the parts of the pump after each use. Now, for moms or caregivers who may have increased risk, like somebody who is working outside the home, it may be good to wear a face mask if you are caring for the baby, especially when you're feeding the baby, because that is very close contact. If you are breastfeeding, clean any areas of your skin that your infant's mouth or pump will touch. Okay. Now, everybody in the household should follow best practices to reduce the spread of germs, like avoiding being exposed to anybody sick. Again, I can't stress this enough, washing hands frequently, and then you should cover your coughs and sneezes. But definitely, if you are sick, you should stay away from the baby, practice social distancing. And then when you're outside the home, wear a mask in public, and also practice social distancing outside the home. Now, just as a caution, children less than 2, it's not recommended to wear a mask, okay, for less than 2 years old. So legacy pediatric providers are here to answer any questions parents may have regarding their newborn, whether in person or over the phone, okay? So, and then we provide postnatal and newborn visits at the clinics across Greater Houston, Deer Park, Baytown, and Beaumont, as well as vaccinations. We continue to vaccinate our children. We vaccinate up to adulthood. And then we can connect you with lactation consultants and everything else that's needed to keep your newborn healthy. During COVID-19, some of these visits can be done through telemedicine appointments so that you don't have to leave your home, especially if you're a new mom and you have other children. That may be one thing you can do to do telemedicine visits. And then Legacy is also continuing to work to make care affordable for all families. We accept most insurance plans, Medicaid, CHIP. We also have eligibility specialists at each location, so we can help you make care affordable.